Welcome everyone to our weekly PBA. Maybe not so weekly anymore, but
Yeah.
the topics are still very interesting and we talk about real life dilemmas. And today it's one of the very important ones because we are talking about menstrual health, about pregnancy and contraception. And we know that right now, with part of the planet, that our planet is being totally overpopulated, but in certain places on Earth, there's not enough good demographics. Kids are not really giving birth, are being born. In other parts, there is too much. So this is a total, mix and mash situation.
Yeah.
That's why with Dr. Kamal, we wanted to give you an overview, and the decision is absolutely yours what to do. But you need to
Yeah.
understand the pros and cons of different solutions to your problem. Okay, Dr. Kamal, welcome.
Yeah. Thank you. And here we are after a few weeks, maybe, with
Yes.
a very hot topic that I think every woman wants to discuss at some point of their life. So we will directly jump into the questions and I'll try to answer as much as possible.
Okay, so one of the questions that we received was from a young woman. She's 30-year-old. She has a boyfriend, goes to work, and she doesn't probably have too much time to think about contraception. But at the same time, she's not ready to get married, and she's not ready to have kids, to be pregnant. So, what are the best options for her? She is healthy, full of life, and of course, her great grandmother, she said, had probably breast cancer or like
Oh,
phase one cancer. She didn't die of the breast cancer. So she has this risk, and what are the best options for her?
okay. So we will start considering the factors that she's 30 years of old, right?
Yeah.
Later, at some point, if she decides to get married and also she decides to get a family ahead, she has to take care from this time only. Because if the first option is if she start taking the pills, the contraceptive pills, so basically pills are of two types. One is the progestin only, that's mini pill, and the other is combined pill that's contain both the estrogen and the progesterone hormone. But if she start taking it at this time and if she keeps on taking it for a very long time, these are all synthetic hormones which you are giving from outside, and you are suppressing your natural secretion of those hormones in the body. So I would strongly recommend at this stage she should not try taking the pills or any other intrauterine device, even if that is hormonal or non-hormonal. And even if you have to choose among those two, the non-hormonal will be still a better option. But
Mhm.
what I have seen in my practice is that non-hormonals like copper iodis, Mirena, and other uterine devices, even if the skin is the skin patch, it's not suitable for everyone. It causes symptoms like sometimes heavier bleeding, sometimes the pain, and ultimately it can lead to endometriosis conditions like this. So still, I would say the normal method that is being very famous from the starting, that to use the condoms will be the best option forever, even if there is a risk, but that's the most safest option still, because you can't just play with your bodily hormones which are being secreted normally. So I would strongly recommend to use that, and even if not that, then the non-hormonal IUDs will be better than the hormonal ones. Thinking of her future,
But
so
it
that
sounds
I
very
would
interesting.
suggest.
So what you are saying is if a 30 or 20-year-old woman start taking the pill, maybe the progesterone and estrogen, the combined pill, and she takes it for, I don't know, 30 years, then she will develop the menopause earlier because of.
Yeah, and that's the most common thing I have seen in my patients. Like multiple times, I have seen the girls who have started taking this pill. In this case, she's taking just because she don't want to get pregnant at this stage. But other causes for which the females take is that to avoid the painful periods, to avoid heavy periods, to avoid mood swings like acne, all these symptoms. What they think will help, that pill will help with that, but that's not the solution.
Mhm.
Ultimately, she will get the menopause at a early age, all the hormonal changes will be there, sudden hormonal changes, and what your body is designed to do at that point of life is not going to happen naturally and smoothly.
Very interesting. Yes, our decisions have long consequences, right?
Yeah,
Long-term consequences. Yeah.
exactly.
Okay, so those are the hormonal, the synthetic hormonal pills. But then you have, as you mentioned before, the uterine devices. What about the uterine devices? You also can have hormones, right? The synthetic hormones in them, from what I understand.
Yeah, yeah. And the most interesting part is that the hormonal intrauterine devices, how they work is that either they will thicken the cervical mucus so that there is no sperm penetration to avoid the pregnancy,
Okay,
or they will stop the ovaries to produce eggs, or they will stop the ovulation, which you're gonna need at some point of time when you are planning to have a family.
sure.
It's like your hairs are going gray, turning gray, and then you want to reverse it. You can't just go back to the normal state once you start taking the pills. Your body is now used to take that pill, oh, easy peasy, and then just do all the work. You don't have to think about unwanted pregnancies. Don't have to think about other consequences. But at some point, it will come back to you, and in a very bad way.
So, if from what you have just said, the device that increases the mucus production in uterus, it's probably the better one. It has less consequences.
No, any of the devices which is hormonal, I won't recommend it at all.
Okay.
Yeah.
Okay. Okay. And it's also
Still, that's
very
why in the first question I
Mhm.
said non-hormonal can still be considered, but not the hormonal one.
Okay. And the non-hormonal ones can also damage your uterus, right, from the inside.
Yeah, that's what
And
I'm
they
saying
can have
because
ingrowns,
that's
from
also,
what I've heard. Yes.
that's also you are interfering with your natural body's mechanism, what it has been made for, the way it has been designed.
Hmm.
Because most of the researches have shown that all the progestin releasing hormones, the mini pills or the combined pills, they have high level of crp, which is c-reactive protein, and it's a marker of a systemic inflammation,
Okay.
and which ultimately can lead to chronic illness like breast cancer, endometriosis, adenomyosis, cardiovascular diseases
So
in the later stages.
that also makes sense because we are reading in the press that there's more and more cases of endometriosis, right? And this is very
Yeah.
painful condition, and it takes really long time to get cured, if ever.
Yeah.
Yeah.
And also nowadays, you have seen a lot of PCOS patients, right? They already are not getting enough ovulation. Then you are taking the pill above that, because in PCOS also, females take the contraceptive pill just to have a timely periods. But then again, you are stopping the ovulation, which is ultimately not going to happen because of PCOS. So you are just,
Mhm.
making your damage to the next level, making it at a double.
Yeah.
That doesn't make any sense. Yeah.
Yeah, that was one of the questions. From what I remember, it was a 35-year-old woman, and she has irregular periods, and sometimes they go for a month or 2 months without period, and she's considering when to go to turn to the doctor or just follow her body. She's not pregnant, and from what I remember, she had no boyfriend or sexual intercourse during that time. So yeah, so that's also problematic. When to turn to gynecologist, or when it's enough to wait and to see what is happening inside of our body, and what are the symptoms we should really look for.
So it ultimately depends on the age, right? If you are not into sexual activity or you're not married, and still you are having the symptom that you're missing your period, you're having amenorrhea or dysmenorrhea, any other symptom like that, it means you can barely wait for 2 months, because sometimes because of the stressful conditions, because of diet, lifestyle, if you have changed your location, you are staying at a new place, it all these things can affect that period. So at that stage, you can wait for at least 2 months and then see. If it's still not coming, then you should see a doctor and get a proper investigations like ultrasonography or any other blood investigations if needed. But in some cases, what I have seen is even if you are 40s to 50s, in between 40 and 50, again the female has started getting this, irregular period, a lot of irregular period, or they are
Sure.
missing their periods for 2 months, 3 months, like that. So
Yeah.
it can be an indication that you are heading
Okay.
towards the menopause,
Yeah. Okay.
early menopause.
So, okay. So, what is the healthy length of a menstrual cycle? It should be 28, or we keep hearing 28, but then I heard recently that it should be 32 days. So,
Yeah, actually it all depends. 28 is just a standard, like, before it was normal blood pressure should be 120 by 180. Now according to the new guidelines, 130 and 90 is also a normal
okay. Mm-hmm.
blood pressure. So it depends on the age. 28 to 34,
Okay.
32 or 33, you can say. Because if it is coming on time, if after exactly 33 days as well, that's not an issue. You
Okay.
should be getting it every month. That's the main thing. You should not skip like for a whole month. You are getting not getting that, and after that, after the whole month, you get it again.
Okay. Very useful. Thank you. So, are there any cases, any situations where hormonal pills or contraceptives would be beneficial to a female patient?
So, first, I will talk about what are the main reasons for which people use contraception,
Okay.
right? Either it is a pill or a IUD.
Mhm.
So, first thing is just to prevent the pregnancy, right? And how it works to prevent the pregnancy is it will either suppress the ovulation or it will thicken the cervical mucus. Second reason for which they use the contraception is for irregular periods. Third one is for the mood swings, again the acne, painful periods, and sometimes to manage the PMS symptoms, which is nowadays very common and people are just talking a lot about it, that I'm getting the PMS symptoms and all these things, and sometimes also to avoid the heavy bleeding. But when you see, like, of course, if you are just typing the birth control pill on Google, and then you are reading the uses first, and next topic is the side effects.
Yes.
And that's a wonderful part that you will notice of very similar things in the uses, and then the same thing in the side effects. Like
Yes.
you will get your periods irregular. Again, you are trading the contraception for mood swings, but again, mood swing is a side effect of taking contraception. It's just reckless, doesn't make
Crazy.
any sense.
Totally crazy. Yes.
Yeah. And it was
Yeah.
like so stupid that most of the people who talk to me, they are taking this, and the most common symptom is breast tenderness as well, which most of the female will get after taking contraceptive pills for a very long time. So I think the mechanical or the most easiest method will always be the use of condoms if you want to prevent it, if you want to keep your body healthy. Even if after certain age you have your family completed already, you are not worried about anything else, but at that stage also you have to be very careful. If your body is designed in a way that this hormone should be at the peak at this age and the other should be at peak at the other age, it should work like that. You should not just keep on interfering with that. I agree there are some situations, there are some conditions where you need to use some intrauterine devices like adenomyosis. Sometimes people are very much annoyed because that's a very painful condition as well.
Sure.
But that has to be very precise according to your body type. What Ayurveda says every time with every condition.
Hmm. Okay. So this is like a devil's solution. Women were given contraceptives for empowerment. And
Yeah.
it damages our body. It prevents, to summarize, it prevents very often contraception, not contraception, but fertility. It decreases fertility and conception, right? Because a lot of young women and men have problem with conception nowadays.
Yeah.
It breast cancer, early menopause, which means aging earlier and having problems
Yeah.
with bones and osteoporosis. So many side
That's
effects
the only
for this
reason that
little
females
freedom.
who are getting osteoporosis at a very early age.
Yes, exactly.
Because when we go back to their medical history, then it comes to the point that, okay, that particular person was using the oral contraceptive pills for a very long time just to avoid the pregnancy.
Sure.
But side by side, she was developing a lot of other conditions as well.
Yeah. I'm sure there are also where I heard about digestive problems, and yes, constipation also as one of the
Yeah,
side effects. Even
right.
no
And
one really talks
even
about.
heavy bleeding. Sometimes people will get heavy bleeding after that, after the usage, even after the usage of 1 or 2 months of that pill or intrauterine device.
Okay, so well, from my perspective and talking to my friends and to patients, everyone wants to have a solution, and everyone wants to have a simple solution, right? This
Yeah.
one pill a day, and you don't have
That's
to
why they just
worry.
take it. That's the
Yes,
easiest and the simplest way anybody can have.
yes, exactly. But it is not that simple, and that's what we are trying to tell you, that the
Yeah.
consequences, and your body pays for it for many, many decades, not years, right? So
And everyone knows if you want to achieve big things, it's always not easy to take a shortest path.
yes, wise
Yeah.
words. Yes.
You have to be very conscious. You have to have some future planning. So in this case also, you should think about your future health. You
Yeah,
can't just think about the present. That only works when you want a non-stressful life. Okay, don't stress about the future. But for health, you should think about the future as well.
definitely you should. Absolutely. That's what we learn
Yeah.
every day. Yes. Watching
Yeah.
ourselves, our
Because that's your
family.
investment for your future health. You are paying a lot of money for the insurance, health insurances. What for?
Yes. What for? I have an easy answer for the generation that is aging.
That's what. That's what. Nothing else.
Yes. Okay, well, thank you very much. This was very, very important for I hope for all the young women, and
Yeah.
I hope they'll start thinking about their lives.
Yeah. And I think we should talk about the side effects because, see, if we are talking about this right now, we can't just stop everyone from taking it. We can just create awareness. People have to understand and then agree. We can't just force anybody. But the people who are already taking it are going through the side effects of these pills. We have the solution for that as well. You
Yes.
can't just leave that portion of the people. Okay, you are taking it. That's up to you. Leave it. You can't do anything about it. We can do. Ayurveda can do.
So in the first part, we talked about different contraceptive methods and what are the cons and pros. And now we are talking about something much more practical. In case if you are taking it and you have strong symptoms, how to get rid of them and how to really benefit from the 3,000-year-old knowledge of Ayurveda to be healthy and beautiful and acne-free.
Yeah. Because I think that's very common when patient comes to our OPD with such side effects and they want to get rid of it. But the first thing that we tell them all is just to stop taking the pill first, and then we can treat your condition. And also, it's not easy to stop it all of a sudden. It might take some time, and then gradually we can taper down and then stop.
Yeah, like with any hormones, right? It shouldn't be a
Yeah,
drastic change. Yes,
yeah,
gradual over there.
gradually. Yeah.
Okay, so please tell us what to do. Yes, I have the strong side effects. Come for help to your office, to your practice, and you are telling me to.
Yeah. First option, I would tell you I would have a detailed description of your diet, of your lifestyle, what kind of profession you are in, so that depending on that, we can have individualized diet chart for you, individualized lifestyle advice for you, and some of the Ayurvedic herbs or the supplements that can help you. And also, what we can do, the major part is that just to replace the synthetic hormones like estrogen and progesterone, we can replace it with the plant-based hormones like the phytoestrogens. I think
Mhm.
that we have talked before as well about it,
Everybody.
some of the phytoestrogens.
Yes.
Yeah. And in some cases where you are taking the pill just because of painful periods, because of mood swings. Depending on the condition or the reason for which you are taking that contraceptive pill, we need to decide what treatment or what herbs and supplements are good for you. So
Okay.
when we talk about, you want to ask about any particular side effect or the symptom, or in general, we should talk about it.
Well, one of the questions that we received was regarding painful periods. The other
Mm-hmm.
was about the acne and the
Mm-hmm.
skin condition. And the third, okay, Dr. Kamal, I think this
Mm-hmm.
was an anemic person who was every month or every 20, 28, 27 days, she had really like 5 day, really heavy period, and she just couldn't deal with it.
Okay. So when a female have a painful periods, it indicates that there is a vata dosha imbalance in her body.
Mm-hmm.
What Ayurveda talks about is first to consider which of the doshas, vata, pitta, or kapha, is imbalanced, right?
Sure.
During the painful menstruation, vata is always involved. Other than that, if you are having clots or very dark color bleeding in that, maybe kapha dosha is involved. And if you have heavy bleeding, like in a day you are just using a lot of tampons or other things, that indicates pitta dosha is imbalance. But vata will always be there. So to avoid that thing, we should do some dietary changes. Like you should avoid no salt, no sugar, no spices, no refined foods, just the fresh homemade food with a little bit of salt and black pepper and some cow ghee or any other ghee or butter you can add.
Mm-hmm.
Because at that time, you need to relax your uterine muscles. They're already undergoing some stress because of a lot of contractions going on inside because of the bleeding. You need to relax that and give them this kind of food. Other than that, you can apply some castor oil over the lower abdomen and put on some heat pad just to relieve from the pain. And also at that time, most of the females, what I have felt is one of the PMS symptom is also bloating during the periods,
Yeah.
or either they will get the constipation or like indigestion will be there. So to avoid that, I would tell you a very famous and a very easy remedy that everyone can do that, and that's a combination of three seeds like carom seeds, cumin seeds, and the fennel seeds. And you can just roast them and make a powder out of that, like a coarse powder, and just take it with lukewarm water, 1 teaspoon twice a day. With like this way you can have it, because I won't recommend it as a medicine. I'm not recommending it as a treatment for everyone. It's
Yeah.
just a general remedy that you can try.
Yeah.
And
Actually, in many countries, that's in, CCF, right?
yes, CCF, yeah.
Yeah, you can buy the tea, or you can buy
Yeah, you can get
mixed.
already ready-made teas as well made of that. Yeah.
In the US, it's extremely popular. When I just spend some time in herbal stores, yes, it's a very, very popular tea for detox. So
Yeah.
totally makes sense. Yes.
And you can make ginger tea as well, because ginger is all-time anti-inflammatory according to Ayurveda. And just to reduce all kind of inflammation during the painful periods, you can just get rid of that with uh, all day. You can just make a infused ginger water and drink that, sip it whole day to relax the uterine muscles and give it a smooth flow for 4 to 5 days.
What about the low energy, the
Okay,
lack of
so
energy during menstruation?
okay, so I would talk about nowadays. There's advertisement in the TV going on when they add about this, sanitary pads or something. They just show up a girl who is doing a lot of activities, jumping here and there, just to tell, just because of that sanitary pad, she's feeling so better and she's having nothing inside. But that's very bad. That's
Yeah.
not true at all. Everybody knows that, right?
Yeah.
Yeah, so for that, I think you should take proper rest. Ayurveda still says that thing. It's not like that you are full of energy during that period. Just think about it as a minor, uh, you know, something different going on in the body. That's not for the whole month. Just for 4 to 5 days, your body is undergoing a relaxing process that
Yeah.
is very much important for you to have a family, to get to get children and have your family. So
Sure.
you should respect that time. You should give proper time. You should take proper care of that time. So for that, you should take proper rest during that time. Don't involve in any strenuous exercises, any gym, any workout, nothing. Let your body focus on that thing so that it can, take all the energy and put it there to have a smooth period.
Yeah, just
I think it makes sense.
yes, it makes sense. And for instance, in yoga, you are not supposed to do any inverse poses, right? Like headstand
Yeah,
or the candle position. Yes,
yeah.
absolutely. Okay. What about the acne?
Okay, so what I have seen among my friends and most of females around me, they will just have a pop-up pimple just before the period,
Yeah.
and then during the period it will get one or two more, and then after the period it'll subside down. So it's an indication that you have a bit of high pitta imbalance in your body.
Okay.
Because anyway, if you're getting the acne, it's because of the rakta dushti, like blood, toxic blood, right? And pitta and blood are always related according to Ayurveda because they have a lot of common characteristics. So just to at that time, if you are getting it on a regular basis, you need to cleanse your blood. You need to reduce the high amount of pitta in the body through virechana, that's purgation that we always talk about.
Yeah.
So that's the best way to remove and to excrete out the excess pitta.
Does
I think we
the
have an article
turmeric?
on our website as
Yeah, I
well,
think
detailed
so.
article about that.
Yes. Does the
Yeah.
turmeric can help? Just drinking
Uh,
turmeric every
with
day?
the acne,
Yeah.
it can in a longer run, but
Uh-huh.
not during the periods
Okay.
because it's bit,
Thinner.
ushna. It's
Yes,
bit
yes.
hot as well.
So you basically have more blood. You're bleeding more when you take turmeric.
Yeah.
Okay. Okay. Good.
But
Oh,
other than that, you can take turmeric milk as well, like golden latte. You
ah,
can take.
yes.
Yeah.
I like it with jaggery,
Yeah.
right?
Yeah.
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 Okay. So, yeah, how long from your practice and from your experience would you tell the transitional period from no pill, from a pill for taken by for 10 or 20 years to no pill? Is this like a 2 months, 6 months period that you should reduce every month the consumption or
Actually, it totally depends how dependent you are on the pill.
hmm,
Because I think everybody once in a while try that if they are not taking the pill, how they feel. Most of the time, females know that if they are gonna skip that pill for that month or for some time, they will be getting these kind of symptoms. So it depends. If you are like very much dependent on that, it might take some time. But what I recommend is most of the times I would try just to stop it at one go.
oh
Because the moment I came to know that female or that person is taking the pill, I just hate it. I just want that person to get rid of it.
you are
But in that case, what we can do is like the way we are talking about the remedies and the solutions, we can take it to the next level, to advanced level. We can recommend much more things than that, so that it's not very, difficult for them to skip the pill, to stop that taking the pill. I don't want that person to suffer as well, right?
Exactly. Yeah. I was thinking about my case study of thyroid, of hypothyroidism, and
Mm-hmm.
the person was taking for 6 months the desiccated, I think, bovine thyroid. And then
Mm-hmm.
after the 6 months, when she was sure that the thyroid start working, then for 2 or 3 months, she decreased every month. She decreased the dosages, and it worked. So
Yeah,
I actually knowing and experiencing the hormonal changes and how my pancreas works, and I also had problems with thyroid. I'm not for the decisive action in one day you take it, the other day you say no.
yeah,
I like the gradual approach because I know that our organs need to get used to the new realities of the system.
yeah.
Yeah.
And also because when I know that pill every time when you are taking it, is increasing the side effect. It is increasing the inflammatory factors in your body, which gonna impact your health later on a lot. So
Yeah.
just to avoid that, gradually decreasing any medicine is always the better way. But when possible, when you think that patient can stop it, patient can stay without that as well, that time you should try to stop it at one go.
Yes, absolutely. And one of the benefits of switching from the synthetic to phyto enzymes or phytohormones, sorry, the phytoestrogen and progesterone is that you definitely will look younger and you will feel younger, right? This
Yeah,
is one of the benefits, important benefits.
because estrogen, that's a female sex hormone, and
Yes.
that is a very, very beautiful hormone, you would say. If you go in deep, if you deep dive into the details of estrogen, you will get to know how beautifully it works. If you are allowing it to do in a natural way, it's definitely gonna do a lot of wonders. You're not gonna get osteoporosis at an early age if you maintain the hormonal balance until your menopausal age.
The quality of skin, the quality of muscles, the quality of soft tissues. I mean, it goes
Yeah,
on and on and on. Also, the formation of fat cells, it's and fat
yeah,
tissue. It's different when you have enough estrogen and when you don't.
yeah, and
So
it also affects your aging process as well.
yeah.
If
So
you are maintaining the
yes,
hormonal balance to a good level, you are not aging that quickly when you are taking the synthetic hormones.
exactly. So this is from the narcissistic perspective, and we all like to be beautiful and young. Think
Yeah.
of the Ayurvedic solution.
Yeah.
Yeah, there's a lot of
That is,
values
and
in this
I'm so
world.
happy to look that people are going towards into it and they are accepting it and they're
Yes,
seeing the results as well. So
exactly.
it's good. Yeah.
Okay, wise words. Okay.
Yeah.
Okay, that's it. So thank you very much. And please remember to be healthy and to live in agreement with the environment surrounding you. Okay,
Yeah.
namaste.
Yeah. Namaste.
Please listen to our channel and to subscribe.